We actually saw the notice pasted on the wall, but the hospital hasn't got anything to do with it. It was just a brief discussion as to see the way forward for the hospital.
The way forward, as in?
Forward, as in NHIS charges. And for example, when somebody goes through a cesarean section, NHIS pays 175 to the hospital. But when you calculate everything, it amounts to over 600 cedis. So that means the hospital is losing. So this was just a brief discussion to see the way forward, just to see the smooth running of the hospital.
So does it mean that the hospital is also considering this issue about co-payment too as well?
No, not at all. The hospital hasn't asked anybody to pay for the hospital fee. That's NHIS will pay part and then the hospital too will pay part, or the individual too will also pay part. The hospital hasn't said anything like that. Okay. Apparently, there are a lot of patients who visit the facility daily. We have about 2,000 plus patients visiting the polyclinic alone. That's the civilian polyclinic and other departments. So let's say we have over 3,000 or 5,000 patients visiting the hospital in a week. So when you look at this figure, you will notice that if NHIS is giving just a small amount to the hospital and we are bearing the higher cost, that means the hospital is losing.
I've been coming here for I think 4 months now. It doesn't cover the scan. I did my scan outside 37. I bought the drugs here. I paid for everything. I gave them the card, but they didn't accept it. So I paid for my drug, but with the consultation, the NHIS covers it. And then, well, yes, I did a lab test and they didn't charge me anything. So for the lab and the consultation, I didn't pay for that. Yeah.
When you come, they have to verify you and make sure that you've authenticated yourself that your NHI is working. Then they'll give you a sheet. You give them a photocopy of your NHI. They'll give you a sheet and go and see the doctor. You join the queue and see the doctor. I've been to polyclinic before for my first delivery, and it was working. And I think about 3 weeks or a month ago, I sent my daughter, my small baby, to Achimota Polyclinic, and I didn't pay anything. It was only some of the medicines that they said they didn't have, so I have to go to the drugstore and buy. But some I was given, and I didn't pay anything for the whole consultation and everything. It works very well.
Are owed from July. Some have just received July, others are yet to receive July. So for August, September, October, November, December, technically everybody is owed that amount once the person has already submitted those claims. And then obviously January. I'm saying January because the contract with them says that payments will be made within 90 days of submission of claim. And so it could be the first day or the 90th day. So for the purposes of, just argument, we say the 90th day. So that means technically from July or August, include up to January this year, it's all outstanding.
So how are your members surviving throughout all this period?
Some have folded up, that is one. Others sought interventions from their bankers by way of, asking for overdraft facilities, etc., in the hope that at least there will be some regular payments so that they can offset. But unfortunately, there has been some hiatus in the sense that the payment did not really follow and go according to plan. And therefore, these overdrafts, you know how they work. Once you don't pay within period, then there's a penalty slammed on you. And sometimes these penalties have also literally wiped out whatever these people were supposed to also get. And they've gone into bankruptcy.
Looking at the position where your members find themselves, then it all puts us in a situation where we are likely to return to the cash and carry system.
I'm afraid so. unfortunately, nobody wants that system to happen. Nobody wants that.
Is there an alternative you are considering?
You mean alternative for my members? Exactly. There are several plans that one can think of, but as a president, I can only take mandate from my membership. For now, they are saying explore all avenues to get us arrears. In fact, they are even talking up to December. Explore all avenues and get us the arrears up to December. And I'm sure, I have a meeting again this afternoon with NHI, and we'll see how it goes.
What are your members saying now? Because I know some health facilities, for now, the NHI only covers consultation. Is that the position of your members too?
Well, the position of my members, as at the time we had that, shall I say, resolution passed somewhere in February, was that we should be paid all our arrears by the end of February. Failure, then we resort to cash and carry. Immediately, we had some intervention from NHI that they were going to streamline things for us. So obviously, like kind of having a fraternal relationship with them, you say, okay, fine. If you say you're going to solve, let's wait and see what can happen.
But this issue of the NHI is also raising concerns about the fact that some members haven't renewed their mandate, I should say. That is also accounting for it. That is the reason why at some point they have to withhold some of these payments for the proper thing to be done before the issue.
Have you checked whether both public, private, quasi-government, everybody had at a point in time not renewed their mandate, their contracts? That's all I'm saying. We had all not. It is not the case that, for example, maybe Mamobi Polyclinic or Fanchinico government hospital had renewed. All had fallen short. So but you were exactly. All had fallen short.
What would make the NHI do such a thing?
Well, then you have to ask them. That's unfortunate. That's unfortunate. And the posturing of some of their members in authority makes it as though the private sector is not wanted. If it's not wanted, let's have it. Let's have that understanding. Then we know exactly what to tell our members, how to move forward. But I can assure you that no government, no country has succeeded in delivering health care without the active participation and involvement of the private sector. In fact, some countries are driven primarily by the private sector. So, therefore, if there are problems, let's all sit and find amicable solutions to them. But you don't strangulate the people who are already on the floor, dying. You don't do that.
So what is the ultimatum that the members are giving the NHI? Well,
I will share that for now, because at least someone has said, come, let's talk. So I'll go and talk. And then we'll know how to move on. Because once the person has asked that, please come, let's find ways and means of solving this problem, it is important that I obey that and give that respect. So definitely I'll go. Today, tomorrow, yes. So once we finish, if there's still the room to go, definitely I'll go. Otherwise, tomorrow is there. It's another day. We'll sit, we'll dialogue, we'll find a solution to it.
What then happens if your concerns are not addressed after these meetings?
If concerns are not addressed, then obviously, for sure, we'll have to go by what we think would solve our problem.
And what do you think will solve your problem?
Several things can happen.
Such as?
I don't want to really give those issues out, but let's wait and see.
The hospital administrators in NHS in Jamaica paying for being between Army Atani for a roundtable discussion on Badwam, just to make sure the reality, the reality on the ground. What peace and bits and bits. See, messages about we see Takwa government hospital. That's what I say.
No, it's not like it's not working. And that's and yet ukata won near you crefso. Until ukwaye beje. But when you say home to say mammy as a more can say one him. Wakwaya honey free. Wakwa labia niska. Name my drone walk about it. Quite run a bit of Omutrian can't do just what about thing. And the drone, I say, and cover walk about 10 wakoto. na na scan so wo mutumi nyo no akwa bonte akwa nti indirectly no wadi o na 37 ade so wo ndi usika na so wadi wo kwa bi so because eduro no wanya bi ama wo akwa bonte akwa akoto nti indirectly wo ndi ye de so wadi wa bon kwa bi so
system how efficient ye nyina intimi
sikatua na ne tua no enko wano enko so nti hospitals bebre ho egu
so can say from busu be
omutua yate enko wano said yes said the fact that
so ba na
hospitals ni ade na omo aye omo de no wow omo brepa because one nya no sa so a wonya nkrofo omo ma national health ni nipa nisika enti obi a register bi ope be obi hospital won tuaka e da ye de say ye de ma ye wa hai eni ye ya o ma card so no so kra no po ye wo mu grace ye de kura grace wonya panimu pa wo de normal silver ye wo gold silver and the bronze ye de ye asie de no ye de ye asie de ye me ne wo me ne balance no ye de ne ye asie de no ai me kura me enan me ne kofi ne kwala enan asie de no ye kura ne nya ba bia na wo nya hospital wo pe po na betimi akọ
eno de we
depends on some hospitals and me ka say me bi na me kirem say no poni na de no aban tu a wo dia na SMP
okay
enti wo mo bre a doctor for especially wo mo national health de ntua ntem e bi na wo tire say otua 175 e kan so ya 6 million de aka wa na ntua enti na che say akwa SMP a ese etumi hwe na wo ka ne ye na etumi ye adwuma national health no nkofo pepa enti wo mo hwe ma enya adwuma yaw jegen wo so wo hwe adwuma de ni bi na wo pe sade a ye di nkomo no na na boyi wono so say ye ho ayefe papa GTP no star ye me ensa nyina e no mama ye ntoma na GTP ko wale a na say watumi de akobi na kama na de na afọ say
o mani age o hwe se na asa o ba betu yi
Adom TV do Prophet TV do right no ma me do cabinet so o betu
we on tama e wo ko ho
na ko ho e bi ka akabati na ka
when na hey
what's up on pesa aka
hey
me de me nyo wa ka be ka bi atena wa ka be ka bi atena e da so wa ye kokko na me atuntu me ka ki wa de ba ye de be si
your brother
yeah no no sister
Amsterdam for so we
and so jam music for you to go yeah no I can't no say I see okay no moja okay, can't you letter?
Yeah,
I say I'm very happy to write you this letter.
That no me say. So when to me am mo say papa bi bu ofu no say ye so le da wo say na ye so le da wo na ko ye ye and one
the segment nyame adom bibia ekosoboko na say EPL standing game back wait to just Stoke City and it time was presaid pem so nyame adom na bekum na afia hwese na nema esie ko baten ko twetwe bia piem say wo Italy Balotelli papa friend Thomas Bewa or den same bia tiansa to just na bakuma bi friend Enoch Bewa say nkofo bi wo Ghana football mu eba na ka che say nkomfa kakra mom na mo fra Branton na 20 bi betwem na nkomo fa nko South Africa na nkosi aka ni bi no otis ka sempe no so wo da bi pena ni pana ka jense o Maradona mu na mutu ayo ti so better say wo fa kakra bre nya sadia
Ghana for ne ko ka che ni
say ai say mo de ne bakuma no on be say baye Balotelli ni akuma e fa ni Enoch Bewa obobo pa
no mo ka say
ti o mu ka chen so say o pese de o ba na national team dia
is that the case obi o pese obobi insanity
we payment
nti omo ba nyina na eturu kakra
asema ye ni dance ya na ye wa hu bi dia dance enti no ne etiti ya na ye de be ye
we have evidence we ye na ye na Balotelli no mo ka chen
Makola law school
na say wa hu bi ya ye de ya dance ye
oh voilà
they see a coach also or say my Black Stars coach no correct
onyan ka hwe say o wakwantum
no to coach dey dey dia o to
sani se munya botema no no koba we dey obeta ha afebo it's too much me so me present afebo
you are somebody